This is in response to Angela's comment. So I get this comment quite a lot. Immediate dentures. Should you get immediate dentures? Should you get your teeth extracted and wait to heal before getting dentures? So I feel pretty strongly about this, and I have been doing this for decades, and I'm going to tell you why I am an advocate for immediate dentures. There are several reasons. So immediate dentures, when placed, they help to protect the extraction sites, the sockets, the holes where your teeth have been pulled. So when you have your teeth pulled, you have these holes, these sockets where they pull the teeth, and blood clots form in those sockets. Those blood clots are really important. This is your body depositing cells, platelets, tissue. So not having a denture in, all of this is exposed. So every time you eat anything or drink anything, it is washing away those cells. So that's reason number one, to have an immediate denture, to protect those sockets, to protect all of those new cells that are being put out by your body to help close those holes and the tissues that is being formed. The second reason, so immediate dentures, when worn, that helps your ridges to conform to the shape of that denture. So let's say you do not get an immediate denture and you are just chewing against your gums. I mean, obviously at first you're not going to be chewing much of anything against those gums because they are very, very tender and very raw. But let's say a couple of weeks into the process, the acute phase has passed and now you're able to kind of gum your food. As you chew against the gums and that bone, it kind of flattens out that ridge. So when the ridge should be kind of shaped like this, all that chewing puts pressure, and it flattens out those gums. So wearing an immediate denture really helps to shape the shape of the ridges and the gums so that it will conform better to a denture, make it easier for that denture to fit. The other reason is obviously self-confidence, which is very, very important. A patient's self-confidence is really affected whether they work, whether they stay home, whether they have to talk to their children, talk to their spouse, talk to fellow employees at work. I mean, obviously it's very hard to not have teeth and to have to face anybody. So self-confidence is very, very important. I know that there are some providers out there that want you to have your teeth pulled and then wait some time before you have your dentures made. And I know patients out there that have had successful outcomes with this. However, it's just not the way that I would do things. It's not the way that I do things. I like the patient's ridges to be shaped. I like the extraction sites to be protected. And I'm very successful at taking immediate dentures and relining them so that they can become the permanent dentures. 98% of my patients, that's how we do things. And I like that because this can save the patient money. And maybe a year, 2, 3, 4 down the road, then they can get a set of dentures, but they can use that immediate denture for years. I think, to be frank, I think that some providers out there do not like to do immediate dentures because it's a hassle. It's a hassle because they have to see the patients often. They have to do many adjustments on that immediate denture because the patient's gums are changing very rapidly, so they're developing sore spots, and the provider has to see the patient often, make those adjustments. They have to do soft temporary relines. It's a challenge. I've been doing this for decades and I'm up for the challenge, and I think it's just a better way to go, but to each their own. Okay, have a great day. Bye-bye.